Ain't that what the kids say? Well, psychiatric nursing. I am a psychiatric nurse. What does that mean? Let's talk about it. I know I talk about nursing a lot. I talk about my role as a psych nurse, but I never really got deep into what I do as a psych nurse. So one of the comment was about psych nursing. So I wanted to discuss it a little, just a little. I tell anyone I'm a psych nurse, they always have their nose up. They say, oh, you want to do that? You get beat up a lot? I don't want to be a psych nurse. You can have it. So today I wanted to come out here and talk about psych nurses, what it is to be in psych as a nurse. Before I was a psych nurse, I was an LPN, like I told you before, and I worked in the nursing home for many years, 10 years on and off, nursing home, hospital. So in the nursing home, you work with dementia patient or Alzheimer's patient, and it could be on a lock unit, and sometimes it's not. And I decided, when I got to Georgia, I worked for the state, and it was also mental ill patient state facility. And I worked there also for many years, and then I got the travel bug, and I decided to travel all over. When I was at the state facility, the reason why I left, the only reason why I left, is because it was mandated staying. When you get ready to go home, they want you to stay because they don't have anybody to replace you. And I got tired of that, and I just decided, it's time to just go see what's out there in the world in California. Even though I traveled and I got experience in seeing how psych is in a hospital setting, because even though it was a state hospital, it was predominantly psych. I work also in a medical facility, and they have in the hospital a small lockdown psychiatric unit. So I would take travel assignment in psych, and then it just grew on me. I decided, yeah, I'm going to become a psych nurse. I balance it with med surg and rehab. And I'm just telling you a little history. So basically, what does a psych nurse do? A psych nurse is a balance to the psychiatric, to the social worker, to the therapist. We give the medication. We can also, as an RN, start a group. We can assess the patient. That's one of our jobs when they come in, to assess them, do a psychiatric, not an intense psychiatric assessment like the doctor is going to do. We do like the nursing assessment. Intake, start the process, get the information. They bring them to the nurse continue the process. Ask them, are you suicidal? What to do and to keep them safe. We do the assessment. Skin assessment is part of that. And then we develop a care plan along with the therapist, the social worker, the case manager, discharge planner, and the psychiatrist. And that's their routine for the stay. It's a short stay for most. If it's not, then they are going to the long-term facility. I have been privileged, and I'm saying privileged because I work with teens and I work with little kids, and I get to work with the adults too, and I do Jerry psych sometimes. So that's basically what a psych nurse do. When I came to from working at the prison, I think I worked I was only PRN in Philadelphia at the psych facility. When I got to Georgia, I told you I work for the state system, and I work for a facility, and they only had kids, and I love it because what I liked about the facility, and the reason why I'm talking about this psych facility is what I liked about it. They had the kids, when you work day shift, you give them the meds, and they have planned for the kids activity. They had the Fulton County school system. I think they had, like, I forgot what they call them, but it's like a building outside that the kids will go to school. So the parents can bring their homework, and they will get to go to school, and they'll come back around 3. So you have all that time to kind of catch up on your charting and do other things in nursing. So the kids will be at school. They get up at 6, get their breakfast, go to school just across in the building, in the same setting, but outside the building, there's another building. That's where the school is. I really like that facility, the way it was set up, that they got to continue with their homework. Then I got to another facility, and I was kind of taken back because I see that the kids really need this activity. They need to continue their schooling, but there was nothing set up, no activity for them. But I don't know. I don't get into that. That's the politics that I don't. But that's some of the way the setup. I guess that's the way they set it up. What else? There's often times when even though they're in school, they can get the nurse anytime because we're there, and if it's an emergency, we go in and we go to school, and we may sit in on the classroom with them. We may go over there and give them meds. They may come back at lunch, eat their lunch, take their meds, and go back to school. So it's really set. So by the time end of the night, time to get ready for bed at 8 o'clock, they kind of tired because they got to get up in the morning. Keep them active. What I like about psych nursing, and everybody thinks psych nursing is an easy job. When I went on travel assignment, I was working around, I was probably the only psych nurse in that particular assignment, the real psych nurse. The other nurse around me, they hadn't really worked in psych, and they work in ICU, ER. They just say, I come into this psych just to have an easy time. ER is so busy, ICU is ongoing. And I really want to say that psych is not as easy as they say it is if you work there long enough. Another thing that other nurse you may hear, being a psych nurse, they don't really respect you. They think that what you're doing is no work as a nurse. You're just sitting around, nothing to do. You're playing games. Yes, I do play games. Part of the procedure with the kids, get them involved to talk about what is bothering them. Yes, it looks like it's a game and it's an easy job. And so when you hear nurses talking about, oh, you work in psych, you don't do nothing, you have it easy, but I can work in psych because I don't want to get beat up. That is not part of the job. And how they keep you safe, you have to go through CPI. And CPI is a training that help you and guide you and train you how to protect yourself, how to talk to the kids, not talk down to them, not in their face, not aggressive, how you use your body language, how do you look at him, how do you step back and protect yourself. CPI, or they call another one, is the man training. So there is training of how to handle escalating issues with the clients. Treat everybody the way you wanted them to treat you. That's what I've always known, because the kids come in, and I'm telling you, the kids will be telling you things that will make you cringe. They will call you names and they're not your kids, and you may feel like you want to react. If you can just think about it, the things that they're going through. And I know that's no excuse, but when people are hurting, they tend to react. And for you, sometimes you're telling them, this is the rules, this is what you're going to do, and this is and how you enforce it. And they're coming into this new environment, and you as a nurse must relate to them. This is what the requirement of the rule. So you got to do it in a way to preserve their dignity. I don't care if they're little kids. I don't care if they're teenager or they're older. You don't want to take away a person's dignity. And just give them respect, even when they're not respecting you, because there's going to be times when they just, that's how you feel. And what I usually do when I get to that, and the kids know how to push your button. So what you do is just walk away, take a deep breath, take a few minutes, and then come back. The requirements, and it's a must, if you're going to give the kids meds, you always have to let the parents get involved. Yeah, the doctor writes, can you give Thorazine to Johnny? Okay, doctor, I will. You get on the phone and you call the parents or whoever is in charge for this, whoever has the custody for the child. Mrs. Jones, Dr. Spearin, order Thorazine 25 milligrams for your son. Is it okay if I give it to him? Are you consenting? And we have a form for that she may say, no, I don't want the doctor to give my child any meds. And then on the consent form, you write, mother do not wish the patient to take any meds, or, Johnny to take any meds. If she refused the Thorazine, what you going to do? You can't give it to her. You can't give it to him. The mother refused it, even though there's a doctor's order. The only thing that would change if it's a court order that the child must get the medication. That overrides the doctor, override the mother. She has to get the medication. So that's the only big thing when you're working with kids. You got to get consent for everything. You got to keep yourself safe from the lawsuit. The parents can come back. I did not tell you to give my child Tylenol. You gave her Tylenol. And how the family know that you gave Tylenol? Luger, well, I was feeling sick and the nurse gave me a Tylenol. Easy. You could be a lawsuit case. So you got to be very careful when you work with the kids. It's very different with adults because they're older. They can take whatever, if they want Tylenol, doctor write it, you can give it to them. So that's just the difference between working with the kids and working with the adult. Now, you may get a teenager that is 18 years old, which is considered adult. So she should really be on the adult side. So, you mean housing on the adult, but she's in school. So because of her 18 and in school, we'll keep her on, she'll sleep with the adults, but her activity is with the teenager. You get it? I hope you do. So there's all kind of thing in psych is safety. Safety for you and safety for the patients. I call them patients. Some people may use the word clients. When you're working with kids, it's safety, because usually the unit is boys and girls. So that's where the techs, the mental health techs come in. And what they do is Q 5 minutes. When I was in Boston, it was Q 5-minute checks. That means you go from room to room. You have a flashlight and you go inside the room, make sure they're sleeping, make sure they're breathing, and you do it for the whole unit. Q 5 minutes in Boston. Other places, it's Q 15 minutes, like in Georgia, it's Q 15 minutes. The only way it will be Q 5 minutes for that one particular child if there's something going on that she needs monitor, the doctor may order Q 5 minutes or one-to-one. When it's a one-to-one, then you have somebody that sits and monitor her every move and just be there with her all the way. That's one-to-one. Q 5 minutes is just checking on her every 5 minutes. And then you have the regular Q 15, especially on night shift. You go to the rooms, make sure they're sleeping, make sure they're breathing. And that's also for the adult, Q 5 minutes. And they may be Q 5 minutes for adults. They may be one-to-one too. And when they're one-to-one, usually is their danger to themselves or something like that. So the biggest issue in psych would be safety. Now, somebody asked me, and I want to answer the question in the comment, do they have LPN in psych? Yes, LPN is in psych too. LPN can give medications. So that's one of the big help to the RN is the LPN. They give the medication, they take off orders. The RN will do the assessing, do medication. Don't think because you're an RN and you have an LPN that you're going to let her do everything. You can work as a team. So the LPN will give the meds. You go ahead, if you have admission coming, you can start your assessment and do the paperwork while the LPN give meds and take the doctor's orders. So yes, you can be a psych nurse too, LPN. So I hope I answer your question. I like being a psych nurse. I know sometimes one of the things that you need to know that you may be going some things in your life maybe not going right and you get into psych. You got to leave it at the door, and whatever you're at home, leave it right there. Open that psych door and just smile and just be different. Just forget about what happened, because you don't want to bring it to work, because you're already dealing in a very depressed situation. They're going through situation where the parents just gave them up, some are abandoned. You may hear some sad stories, not only from the kids but from the adults. So you need to be mentally capable of dealing with these situations. Do not bring your problem. Do not discuss your life with them. Do not, sometimes it's hard for people to say, oh, I've been through that. Sometimes there's a time that you need to tell, I understand you, yes. But you need to know that whatever you're going through in your life, don't try to make it any worse. It will make you feel more sad and you might not be able to handle your work. And if you get to that point, just step away and take some day off, because this can be stressful. Mental health, being a psych nurse, having that mental break away from the facility is help. So if you're doing all your overtime there in that situation, God bless you. That's all I can say. So I told you why I became a nurse, why I choose psych nurse, because I felt like I'm able to make a difference. I hope that I have. The reason why I said it's very important as a psych nurse, some new nurses, they go straight into psych nursing. I wouldn't recommend it. It's a good field. If that's what you want to do for the rest of your nursing career, then go ahead. But I feel like psych nurses really need to get that maybe not med surg, but that medical background, because in an emergency, you may overlook certain things. And I don't want to go into it, but there are times when you may miss. If a patient come to you, they hadn't had a bowel movement, excuse me, for a couple of days. We give them Maalox, and we overlooked that, and it didn't work, and we tried this, and we getting these orders from the doctor, right? And we just try everything, but it didn't work. If you had work in medical, 3 days, we got to do something. Nothing is working. We got to take this very serious. So being a psych nurse, you not only deal with the mental, you may deal with the side effects of the different medication, could be constipation, all sorts of things. You may have to draw blood, and a lot of psych nurses don't do that because they haven't worked on the medical fields. They haven't worked on the medical unit. So those things are often overlooked, and it's a good idea to have a combination of predominantly psych nurse and a nurse that has been in the medical field, been on the med-surg floor, know about IV, draw blood and stuff like that, because it helps. It helps to be, and I think for me, being in the prison system, it was intense ER, I would say. It was busy like an ER, and so I got all those skills in emergency, and it was able to help me in psych, and I dealt with psychiatric inmates, the side effect of their medication, know when the situation is critical and what to do. And I think that's being a psych nurse, just psych nurse only, and never had a medical background, never explore it. You missed out on your expanding your thinking, critical skills. And I've worked in situations where, like I said, the bowel movement was overlooked, and it was a major catastrophe. I don't want to get into it, but it was major. A simple thing as just missing that. A simple thing as when we work in psych, we not only have to think about the whole body system. We can't, it's mental, but we have to think about the body and how it works. You know, go back to a little basic of anatomy to keep yourself fresh if you don't want to go into into psych. Make sure you read up the medical part, because you may be in a situation, and I happened to work at a facility and they had a situation where this was in another state, and the nurse said, I don't know how to draw blood, because, you know, they never teach us. Psych nurse don't draw blood. They don't have a doctor at this particular facility, and it was in California, it was on the psych unit, but this particular facility, they wanted us to start an IV until they get the patient transfer out. So you have to know these things. They ask for us to draw the blood at night shift, draw the blood. They don't have phlebotomists. So if you don't have those skills and you're all the nurses are psych nurse, then you can't, I don't know how they deal with it, but it's a good idea because some things you might just overlook. Major thing in being a psychiatric nurse that you should look out for is, when you work on the psych ward, documentation, 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 every little thing, because it will come to haunt you. In psych, like you said, the reason why they say it's easy, you may be giving a group, you may be just talking with the kids, and some of the facility have computer charting. They do Epics, that's in California. In Georgia, they don't have that yet. It's paper charting, and you know what that means. It may be a little charting, and you feel like you're doing the same, charting the same thing over and over. It becomes redundant. And that's where the problem is. because of that, you tend to get too relaxed. And I'm speaking not for myself. I'm speaking about my mistakes and how you become so relaxed and you say, oh, everything is going right. And sometimes things just happen when it's so quiet. The kids kick off or something happened, fight and everything. And then you are called off the unit. So you may forgot that you needed to write this incident report because you was in a fight. You put somebody in restraint. You need to call the doctor. And you may forget to call the family. So all these things we need to tighten up on is documentation, because documentation is a big issue in nursing, period. You know what they say, if it's not there, if the medication doesn't have your signature, that means you don't give it. If you say I give it and you home and there's nothing there, it seems like you didn't. So you got to document the medication, document any incident, little as it may seem, a little scratch. A kid came out with a little scratch. He could have scratched himself. Anything. You document it. And for me, what I'm seeing too, we get so relaxed because, oh, I'm getting a break from ICU. This is a piece of cake. All I got to do is talk to the kids and that's it. And that's not what psych is about. You need to, constantly observing, assessing. Documentation is very important. So I wanted to bring that point to you because my boss drilled it in my head. Patrice, documentation. And she will literally find me to make sure. Did you work there? Did you have this incident? I have told you 300 times, Patrice. No, she don't do me like that. She just don't give me no work. And you just hear it from me. Anyway, I just wanted to bring this very important. Documentation is very important. Giving the right medication to the right patient, because the right time, your 5 rights, you better get it together. You have to know that and the reason why I'm stressing this, because I made the mistake too. I was about to give a medication. And the kids may take off. Not only the kids, the adult too. I don't want to take this band, this thing on me, armband. I don't want it. I throw it away. And so you thought you know this person. That is John, right? But there's 3 other John, and you go to give meds. And I've been in a situation where I'm about to give the meds, and I listen to the patient say, oh, my pill used to be pink. So I had to, just a minute, I'll be right back. And look, so I'm about to make that major mistake that could cost me my license. The patient doesn't have an armband. I have to rely on pictures. That's what they do. I can't rely on the other nurse say, oh yeah, that's John, give him his medication. Because we all tend to make that mistake sometime. So what they do in the medication book, they have a picture of the child. So if they don't have their armband, I will try to get them armband. But if in emergency and I need to give them this medication, there is pictures in the MAR, the medication book, that you can look at and say, oh yeah, that's John. Take your pills. And what I like to do, if the patient say, I didn't get this pill yesterday, I got a green one. I said, just a minute, let me look. And I double check again, look in the medication book, and I show them. I show the patient, child or not, kid or not, I show. See, the doctor changed your Zoloft to this Yesterday you had 25 milligram. He increased the dose to 20 to 50. And I got your mom consent. And so that's where the color difference is. I try to show them so they know and keep them informed about their medication. But the pictures in the MAR is the key that will help you. Safety nurse, your license. Remember, don't let them take it away. Give it when you are ready. If you like this video, please leave a thumbs up. Thank you. And have a wonderful day or night in your state or your country.